My name is Gospa Ayoma. I'm from Lagos, Nigeria. And I came here for medical treatment. I had to come here because there is no solution in Nigeria.
Mr. God's Power arrived to the Herzliya Medical Center in actually quite a critical condition. He had a very aggressive cancer to the bones of the lower lumbar spine and to the sacrum, which created an instability and a dissociation between the lower back, the spine, and the pelvis. In other words, there was a disconnect between the spine and the pelvis because the cancer ate all of the bone that connected between the lumbar spine and the pelvis. There was literally nothing, no bone to withstand weight. And this is what we call a dissociation or a disconnect between the upper part of the body and the lower part of the body. And in other words, severe instability. Clinically, what this meant was that he could not get up. And even in bed, when he tried to move from side to side, this created severe pain because every time he would try to move his body, the legs and the pelvis would lag behind, and this would also stretch the nerves and create severe pain and radiation into his legs.
When it started, I was just calling it waist pain. I didn't know it was that, complicated. So I started taking pain relief. And when I did that for some time and it was not going, I went to my hospital and they also started giving me pain relief. After 1 or 2 weeks, they sent me for a test. That was when they discovered that I had lumbar 5 disconnected, that there was a crack on it, and that something was needed urgently to correct it. So that was why I came. And at this time, I could not bend down again. Pain all over the waist, pain all over the 2 legs. I cannot sit as I'm sitting now. I cannot sit up. I cannot walk. The only comfortable position was lying down. And this has been my condition for more than 6 weeks now. First of all, when we had need to come, to go out for treatment, we had some countries in mind. But for me, it was in my mind to come to Israel. You may want to ask me why. I've worked in Israeli company way back, maybe 30 years ago. Yeah, thereabout. And I know they are very, very thorough. Whatever they are doing, they are good at it. I say, if we also have a doctor from Israel, if he knows anything related to my problem, he will also be able to resolve it. So that was how I decided. And also my cousin, who is also into medical sciences, said that he knows some doctors in Israel that are very good. So that now confirmed my choice to come to Israel. Which hospital? We don't know. So we did that on the website. We got, first of all, Asuta and Herzliya. But you may ask me how I came to zero on Herzliya Medical Health Center instead of Asuta.
Yes.
We were writing to both hospitals, but the response we got from these two hospitals, this place is wonderful. We just described my problem, and almost the same minute, Lisa replied immediately. So we started talking, and as we were talking with this hospital, so we were also talking with Asuta. At a time, both hospitals asked us to bring some documentations, maybe former treatment, whatever, medical report from my former hospital. We sent it, but the way this hospital responded is wonderful. I still continue to say it. I don't know Lisa before. Lisa Kutang is a wonderful worker. It's a good image for this hospital. When we made up our minds to come, Lisa said that the hospital will handle we apply for the visa from here in Israel to Nigeria. So which they actually did. But my condition was such that I cannot leave my house to Nigerian state capital, Abuja, because I cannot sit upright. I cannot walk. So how do I go to Abuja? My wife that would have gone for us was also my caregiver. She cannot leave me alone at home and go to Abuja to apply for visa. So somebody somewhere spoke to the ambassador in Nigeria, and the ambassador said, yes, for such a case, we can help them. Let them post their passports, and we posted the passport to them. In 5 days or 6 days, we had our visas without necessarily going to your embassy. Lisa again helped us, connected us to an agent who got us a hotel. We arrived to the hotel on Saturday. Then the next day, we looked for the hospital, which was just opposite the hotel. And we had some scheduled tests. So we went through all the tests that day on a Sunday. Then the surgery had to wait until about 4 days later because of financial transfer issues.
So actually, I was pleasantly surprised. I think that the doctors in his home country did a very thorough investigation. Many tests. He had a total body CT, he had a bone scan, he had an MRI scan, he had multiple blood tests to try and establish a diagnosis. Unfortunately, they did not establish a diagnosis. They were able to point toward a possible cancer as the cause of his pain and his disability, but they could not establish what kind of disease this is and what kind of tumor this is. And I actually think that in these kind of cases there is often no other choice but to go in and take out a piece of a biopsy of a vertebra or of the cancer and send it to pathology to actually get some histological slides and make a diagnosis.
We are going for something critical, something unknown. The result could be either side. But I came all the way from Nigeria, I had to do it. So there was no way I could go back. So as early as 8:30, we were in the hospital and some preliminary documentation started going on. By few minutes to 10, I was already wheeled to the theater. And that was the last thing I knew until about 5 hours later, when I found myself in the recovery room.
The goals of the surgery were basically three main goals. The first was to actually establish a diagnosis, because all the tests that he did up to now did not actually establish what kind of cancer this is, what kind of tumor this is. Therefore, to actually obtain a biopsy, an open biopsy of the bone and what's left of the bone, and send it pathology was the first goal. The second goal of the surgery was to reestablish the stability and to connect the torso, the upper part of the body, and the spine to the sacrum and to the pelvis, therefore thereby creating a sturdy construct that he can stand upon. And this we call fixation. The third goal of surgery was to call decompression of the nerves, basically to release the nerves that were entrapped in the tumor, in the cancer, and were causing such severe pain to his legs. These three concepts were achieved using a unique Israeli patent that was actually developed right here in Herzliya, not in this hospital, but right down the street. This is a patent that it's a material that is sort of like putty. It's a cement. It's a medical cement, but it is very high viscosity cement. And what this allows us to do is to combine some sophisticated surgical techniques of resecting the entire tumor, which we today do all from a posterior approach without the need to open the abdomen or to open the chest. We can do the entire surgery with a midline incision from the back, just like regular spine surgery, but include a complete resection of the entire vertebra and tumor with it. In his case, by the way, we removed 3 vertebrae. We removed L5, some of L4, and some of the sacrum. We removed the entire tumor, all from a posterior approach, leaving the nerves intact, hanging in the air, because we released them all around 360 degrees. But there, at that point, we had a huge void, a hole, because we took the whole tumor out and there was just nothing there. From the middle of the spine till the pelvis, there was just one big hole. Then we used this Israeli patent to fill in the gap, this void, just like you would do with cement or Play-Doh or ceramics. You actually mix this material and you fill in the void. We added some hardware construction into the cement so that it will all harden with the metal inside the cement. And this we tied to the posterior spinal fixation, to the pedicle screws that we put above the tumor and into the pelvis. So this all created one big construct that allows him to actually sit and get up and bear weight and walk literally a day after surgery, because as opposed to what we used to do many years ago, where we, for a case like this, we would have to do 2 surgeries, one from the back, open up everything and do a fixation with screws and rods, then flip the patient, go from the front, open the abdomen, take out the tumor while having to remove and retract the intestines and all the contents of the abdomen and the chest. The current new technology that we used in his case is a game changer, because he didn't need to go to the ICU. He didn't need to be in the hospital for a month. He didn't need a long rehabilitation or recuperation. He actually was able to get up and start walking the day after surgery. And we're very happy that we have these new techniques and new technology that allow us to do these kind of surgeries.
The pain was terrible, and I wasn't sure if the correction was already made until Friday morning. your physiotherapist came, 2 of them, and said, we want to try to go out for a walk. In my mind, I was, are you out of your mind? They said, you have to start to learn how to walk now. So they encouraged me to get out of the bed, and I got up with the help of a walker. I took some steps, and I could not believe it. I sat down, sit up, no pain. And that was a miracle to me, considering the pains I've gone through for some months now, even though it was unbelievable to me that I could still walk with my feet. But the next day being Saturday, it was much better. You know, I could take more steps with a walker without so much apprehension and pain, unlike the previous day. Okay, my medical situation now is good, just that I cannot walk alone without the help of a walker now. I'm looking forward to a time when I will be able to walk without the assistance of a walker and the cane, the walking stick. And considering the enormity of the surgery, that we will have to allow healing to take place naturally. So, you know, walking and doing other things normally, as it used to be, will take some time.
It is true that with time, he's expected to regain some of the muscles that he lost in the past 2 to 3 months. Any person, even a healthy person, that lays in bed for 2 to 3 months loses muscle power and muscle mass. And so some of the recuperation and rehabilitation that he's going to have to do now is just to work on the ability to stand, to walk, to strengthen the muscles. On top of that, of course, we give nutritional support, again, because he lost a lot of weight in the last few months. And with all this, he will have to later continue his oncological treatment. So that's down the road. Immediately after surgery, he actually recuperated very well and did not need to go to an intensive care unit. He went directly to a regular department. And that very night he rested and was already able to sit up on the very night of the surgery. The following morning, with the help of the physical therapists, he was able to sit up, stand, and actually started walking across his room, out the corridor, and all the way to the nurse's station and back the day after surgery. And this was a very nice result for us clinically also. So I think one of the learning points from Mr. God's Power case is that the world today is a big global environment, and there are so many different treatments out there. Not all of them are readily available close to home, and in some cases, when there is either a question about diagnosis or that the type of pathology is severe, such as cancer, often it is actually quite wise to look wide and broad to try and discover where you can get unique and special kind of treatments that often are not available in other areas of the world. This is true in general. Specifically in this case, I think that we were able to afford Mr. God's Power with a very unique type of technique and a unique kind of material that in combination enabled us to give him this kind of result. I think that the advantages of our new and unique type of surgical technique are substantial. And in saying this, I look at myself. I would, up to 6-7 years ago, I would also use to do the surgeries, just like we used to do for many, many years, which basically is a back and front surgical approach, meaning 2 surgeries for the treatment of these kind of situations of cancer in the bone. The clinical consequences of doing 2 surgeries like that are substantial. It's usually associated with significant blood loss. We're talking about 2, 3, 4 liters of blood loss in the surgery. Also because it's a tumor, also because you're making 2 incisions, and they're very big incisions. Especially the incisions in the abdomen and in the chest are incisions that go through all the muscles of the abdominal wall and the chest. This creates significant bleeding. Not to mention the fact that to reach the spine through an anterior approach through the abdomen requires that we move all the intestines and all of the intra-abdominal cavity. And of course we have to move the greater vessels. The aorta and the vena cava often have to be retracted or even moved just to reach the tumor. This creates significant bleeding. It creates significant disability following the surgery. In other words, because a patient comes out with chest drains and abdominal drains and a very large scar on his abdomen, it often takes weeks, maybe months, to recuperate after the surgeries that we used to do years ago. Our ability today to do the same goals, to achieve the same goals, and even better in surgery with just 1 incision and a small incision in the back are a game changer. They make a completely different recuperation and rehabilitation period, where the patients just go, just like a regular surgery, they go to the department the night of the surgery, and the next morning they start walking and can be discharged after 3, 4, 5 days after surgery. This, for a patient with cancer or with a tumor, is extremely significant, because every day that you can give him better quality of life is extremely important for patients with cancer.
I will gladly introduce Azalea Medical Center to friends, neighbors, and other people. I found out that most of the medical doctors, they are good and they speak good English. Yes. And they are very, very meticulous in their jobs. So, and I'm not here to praise them, but from my experience with them, I think they know what they are doing. I discovered that life in itself is really, really short. Very short. So all of us should be thinking of our latter end, because we go about, just moving. If I ask you, you have 10 years plan now, but nobody can tell if we will see the next 5 years. Because for me, I've never been sick. That the first sickness I'm having, and it came in less than 6 months, I was down and I could not move. I could not believe my eyes. So we should always learn to prepare for that end of our sojourn here in this world. I will tell any friend that I know has a challenge that there is a place I know in Israel that can do, if you like, wonders.